Welcome to On the Edge with April Mahoney Brains. Here, this is the spot where the conversations are pointed, the guests are sharp, and the responses are never dull. Did you bring your thinking caps? Because it's time to put them on. Because the conversation starts now. Okay, I call her Dr. Ruchi. Okay. She's an amazing woman. She's a beautiful woman. She's a beautiful soul. She's a mother and she's a physician. She's going to talk to us really about what life has cost her, bought her, and taught her, what she's pouring into other individuals outside of, prescriptions for wellness and how to take care of themselves. I'm so excited to have her here with us on the show. So we want to also talk about your true voice, having a level of confidence and taking action towards gaining power to have a magnificent, magnetic, majestic life. Because the struggle is real. I say that all the time. And people are struggling. And you know what I'm going to ask her about? Why is it that people sometimes don't want to get help? I see that. As a physician, you see that. You'll diagnose something or something will happen and people don't want to go to the doctor. Is it a denial? Is it fear? They don't want to face reality? We're going to talk about that and then some. Tell us a little bit more about you, Dr. Ruchi.
Oh, lovely. Well, so let me start with my humble base. So I come from India originally, and I come from a family with my parents being doctors. So it's like either you're a doctor, engineer, a professional, or a failure. So that's where a poor child's journey begins. And you can hear me, yeah?
Yes.
Right, wonderful. So that's where the journey began. So I was this obedient child. Biggest thing, validation from my parents. I am a medical doctor, came to UK, and what happened was, there was this question of authenticity and gaining approval. I think that's where I came to crossroads in my life. As a child, I think almost all of us is like authenticity and approval. I have to tone down my authenticity to have the approval from people I look up to. So I'm like, am I toning down my authenticity and gaining approval? What is it really getting me? I was like, no, 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 that's not fine. I have to like find my own voice, my own authenticity. So things were going fine. It was when I was pregnant at the end of pregnancy, and so this is COVID time. First 5 months is just me with my baby. My better half was there for 4 weeks, but that was it. So I'm in a really, really, really dark place, and I'm thinking, no, I can't be a good mother or be a parent to my child that I want to be where I am. So there began the introspection that I need to look within. I need to find the light within. Where do I go from there? That's where I came across Mind Valley and Vishen Lakhiani. So it was like, I'm driving this car. So I'm seeing this little light. And then as you see the light, you take the next step. And then you're driving, and then a little further and a little further. So with all of these steps, I came to Mind Valley and Marissa Peer and found rapid transformational therapy, which was really transforming for me. So if I were to say hypnosis, people are like, "Oh my God, are you going to control me?" But no,
Oh, I've been taken under. I can take myself down. Let me tell you, it is off the chain, brains. You need to, because they're not going to make it. It's not a carnival show, okay? They don't make you quack like a duck and bark like a dog. You are really, your body won't do anything, or your mind won't do anything that you're not kind of prone to do anyway.
Yeah,
It's a
yeah. I
matter
mean,
of
you're in
suggestion.
control. Yeah, totally, totally. So basically, rapid transformational therapy is a brainchild of Marissa Peer, who it's like let's say some total of her 30 years of practice. So I was like, okay, this has really changed my life, transformed me, helped me. I'm going to train in this and help people get to the same place. if I was to summarize what it is, it's like we are all this miracles, the authentic diamonds that we came into this world, here to shine our light.
Yep.
And then just imagine this diamond being covered by lots and lots of layers, so much so that you don't even know that the light exists. So
Mm.
these layers are lots of social conditioning, limiting beliefs, could nots, should nots, more shoulds, and so like no coulds at all. So basically if we could just get this layer by layer away, every limiting belief that is caging you, so what comes out is the true essence of you. So to give an example, let's say, for example, somebody is feeling, well, I want to be really, really confident, I want to speak my truth, and maybe I want to do public speaking, just as an example. Now they have trained, did everything they had to do, but it's like something is constantly going on, this inner dialogue that's like, no, you can't do it. No, you can't do it. No, you can't do it. Now, the thing is, if you were to ask a 2-year-old or 3-year-old, I mean, none of us were born with that fear, right? So we came free, and
Right.
then you
Right.
basically held on to that luggage, and one by one and one. So basically, it's time to return all of that luggage because that doesn't belong to you. Any limiting belief that you have that doesn't belong to you, just let go of it. None of us was born with any limiting beliefs. We were born with ultimate confidence and unlimited self-belief. And they're just miracles to basically be who we are rather than, literally comparison be the thief of our joy and our calling, going around
But
comparing
you
us.
you were suffering from postpartum?
I was. But the thing is, when I mentioned that to somebody, people expect me to say that I was going to kill myself or my baby. So, no, that wasn't
Girl,
quite it.
let me tell you my postpartum story. Oh, I was so excited. I could get back in those jeans, and I had on a cute little top, and I had put on a little push-up. I'm gonna look really nice and attractive for my husband. And the baby went nuts. Oh, I had just cleaned her up and did her hair. She spit up everywhere. She's screaming. She's crying, you know. And he gets to the door, and the first thing I do is hand her to him and say, you do it. People do not understand. Everybody or every female is not cut out necessarily to be a parent.
Thank you
That
for
is
saying
okay.
that. No, seriously, because I think the societal expectation is if you're a woman, you're a mother. See, everybody is at it. I mean, think of a time, say 100 years back, 200 years back, where, like, maybe at 14 or 15 or 16, you're a mother. It's like you have known no other life. Like, maybe you
Right.
didn't even have an option. So now, like, you go in as a choice, and obviously you want to do your best, but it's a lot to take in. It takes
It
time,
is.
it takes,
And
it's a
the
lot.
expectation, and I say this, because we are both women of color, our culture.
Yeah,
There's no
totally.
excuse. I mean, there's no excuse. You are a mother and you just gonna deal with it.
Yeah, yeah, that's it.
My daughter just told me, she says, I'm getting you a grandpuppy. I'm not having any children. And I was so kind of upset, but she says it's a different world, Mom. We live
Yeah,
here. It's hard, and sending your kids to school, you don't know if they're going to be safe. You don't know
true.
what, different effects that they're going to have. There is a whole different life cycle that's happening right now. And she says, I just want to
Thanks.
grab my purse, my keys, my cell phone, and go. I don't want to be responsible for that. And I get that. But our cultures are, not only are we mothers, but we're caregivers to our family members. It's generational. And that is a cultural norm. There's no conversation in that. We take great pride in that. But
Mm,
to whom much is given, much is required. And then here you are, a dedicated medical professional. You're taking
mhm,
care of everybody else's. And then the people at the hospital and the board of directors, and trying to find
mm,
something for yourself. So I'm glad that you have come to this awareness. When you settled in and
mhm.
found this newfound glory, what did you say? Did you go buy yourself a cute little dress and some new lipstick? What did you do? What did you reward yourself? How did you say, wow, I have arrived?
I think even when I started with the journey, and when I was really happy was when I completed the certification, because the whole digging and prodding and everything, step by step. So I got into it when my little one was 4 months old, and I think by the time he was a year old, it was all done, dusted. And yes, I did reward myself. So I had a spa day for myself. I was like,
You have to see, that's what people don't do either. They don't take the time to reward yourself.
no,
I
you
pat
have to.
myself, well, I pat myself on the back before I wait for that outside influence. Some people confuse
Totally.
that as vanity or arrogance. It's self-love. I cannot
Totally.
love you the way that you deserve to be loved if I don't know how that feels and give that to myself.
Simply, it's like if your cup is empty, you're coming from a place of lack,
Yep.
and then you are giving other people from a place of negativity, of sacrifice. Whereas when your cup is full, you're just giving with a wholehearted love. I think it's really important. And again, as you said, the culture teaches you, no, I'm going to place myself last. No, that's not how it works. If your cup is not full, if you don't take care of your own needs, you cannot be there for anyone else. So that's really, really important. Yeah, yeah.
So now, do you incorporate RTT in your practice wherever you can? Do you share that with your patients, or is
Yes,
that
I
something?
do. I'll tell you what I do. I mean, because I am working in the hospital setting, so I can give them some tips, tricks, suggestions about, things during the sessions. Obviously, I have about 20 minutes or so with each patient as such. So I think that was another reason. I'm going to be really honest here, because I think when you go into healthcare, you really want to help. Now, this is me, like, when I was on the burnout stage. So I'm leaving home at 6:30, starting my day at 8 o'clock. You've had a long, hard day. And the thing is, there's lots of bureaucracy. Like, in say I'm doing a clinic, there has to be this many number of patients that I have to see. So it's like you've done a lot of work, but what's lacking at the end of the day is fulfillment. You're not really feeling fulfilled. I was like, okay, this is good, but there's something more. I'm looking for that something more. And I think in your darkest times, or let's say, then you have, so it's like you're not in the rut of running to the hospital every day. It's maternity leave. I can step back, and that's when you're like, oh, okay. And then you go within. And I think that's where the whole journey began, me finding RTT and Mind Valley and my daily meditation practice and all of it.
You have a daily meditation. I'll tell you something else about me. I had to slow down on my meditation, and I'll tell you why. Well, again, like I said, I can take myself down, but I was getting downloads of information.
Hmm.
I was getting, and I felt like I was, again, in this situation of trying to heal and find balance, I was finding myself overwhelmed,
Oh.
and so one side of the spectrum or the other. And I
Hmm.
really had to have a talk with God. I had to come to Jesus meeting. I said, look, can you give me mine in bite-sized pieces? Like Reese's Pieces. Can you give me a little? Because I was overwhelmed and I felt like I had to act on these things because so much was going on at that time. And I am a giver to a fault. I'm a person that recognizes, I'm not an empath, but I'm very empathic.
I'm an empath.
Yeah. And that's even doubly hard because you take on the person's energy, thoughts, emotions, and they're across the street.
Yeah.
you
I mean,
know?
I've been told a lot of times, oh, being an empath is a power. Trust me. I mean, from the point of time, I think as a child, you don't realize it. And you only, because everybody feels the way you feel. I think it's early teenage when you feel, no, there's something different with me. Other people work somewhat different. And then you're like, by the time you realize it as a power and you can learn to manage it, it takes years. It takes years. So
It
yeah,
does. It
that's
does.
another
And then
journey.
then you have to also balance the people that don't understand what you're doing. Are you a
You have.
whiner? Are you a whiner? Are you a complainer? Are you depressed? Are you sad? Blah blah blah. No, I'm in my
No,
feelings. I'm
I
trying
just
to connect.
sometimes you just need a bit of a timeout. Like, I need to recharge my batteries and then I'll come back as my whole self. I mean, luckily I have a partner who understands how I function, and we met really early in life. So I think we know, well, all the ifs, buts, doubts, whatever could go wrong has already gone wrong. So
Right.
we are
That's
fine.
beautiful. That's
Yeah.
beautiful because you have somebody to walk on this journey with you. So now, are you planning to maybe increase your family? Do you think that you want more children?
Yep, I'm done.
I know. Stick a fork in it. I'm done. I'm with you. I had one and I was like, oh, okay. My grandmother had 9. I was like, this is
Oh,
overrated.
no, 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 seriously. Like, uh, I was like, when I was really ready, I was like, okay, this is the time. And I was 35 at that time. And now I'm like, after he's almost going to be 2 in a couple of months. And no, I'm done. And I'll tell you honestly why. I would have loved to be an only child myself, but obviously that wasn't my call to make. So I'm like, yeah, there you are.
How many siblings do you have?
I've got a younger brother. He is 3 years younger to me.
Okay. All right.
Mhm.
So now what would you say to a person, male or
Mhm.
female, Dr.
Mhm.
Ruchi, that is struggling right now? They just really doesn't even know how to start putting the pieces together. What would
Mhm.
be some baby steps? What would be some things that you would encourage them to do?
I'll ask them to do 3 simple things to start with. Like, first of all, acknowledge that you're a human being, you're doing your very best, and give yourself some self-compassion. I think we are really critical on ourselves. It's like, oh my God, I didn't do this right, and that right, and that right. So some self-compassion. And simplest way to do it is, say, morning you wake up, you're brushing your teeth, right? So look yourself in the eye and you put down the brush and you're like, I love you. So you look yourself in your eye and you say, I love you, all of you. I love you just the way you are. And I'm the loving parent you all, I mean, I'm your loving parent. So, or you can add or delete whatever works for you. I mean, first couple of days, this might feel a bit, unusual to some people, but I can tell you from, my friends, if you keep doing it, it really, really transforms the energy of your day. Second thing I would highly recommend is basically just when you start your day, a piece of paper or maintain a diary, 2 minutes of your time, 5 things that you're grateful for. So
Yes.
that, yeah, because I think when we are really focused about, oh, how do I, there has to be things that's going right in your life,
Yes.
right? So just people like, oh, I don't have time. No, everybody has 5 minutes. Everybody has 5 minutes. When you're on your commute, on your phone, pen to paper is better, but it's fine. So just 5 things. At the end of the day, again, 2 minutes of your time, 2 sentences, the magic I witnessed today. Every day, no matter how difficult the day might be, there are moments of magic. So that's what you catch on. I think it's where your focus is. And what happens is slowly the energy starts to shift. I'm not saying this is going to overnight transform anything, but it
Mhm.
helps you change your perspective. It helps you develop self compassion. It helps you live from a deeper place rather than totally be burnt out by stress and outer circumstances.
Wow.
So, yeah, yeah, just a couple of things. And I'm telling you about my own journey because if you meet somebody who's needing outer validation, I think I would have been topping the list even about a couple of years back.
Mm.
It's exhausting. It's
It is.
exhausting. Because I think I always say, even if you decide to leave your body, there would be somebody to say, "Oh, why did that person die that way? They could have done it this way." So
Right.
so it's like no matter what you do,
No.
there would be somebody who would not be happy. So you cannot please anyone. And the thing is, I'm a very spiritual person. I would say if all of us, we have come here for a purpose. So your soul's journey, I think it has to be bigger than you coming here to please anyone,
No.
isn't it? Yeah. So there has to be a bigger purpose. I think, and again, the revelation of your soul's journey is not going to be like, I don't know, I had some revelation. Just take one step within and one step and one step. And another thing I would say is, we look for answers outside, you know,
Right,
uh,
right.
no, all the answers lie within you. You cannot Netflix your feelings, you cannot drink your
No,
feelings,
you
you
can't
cannot
Netflix
shop
them.
your feelings.
Oh my God. Don't bust my Netflix. Cause honey, I'm
No,
a
no, no.
I'm a binger. I was binging the other night. My husband goes, it's 4 o'clock in the morning. I said, I know it's only two more episodes. But no, and I get it. But people want to put a blanket over it. They figure if they cover
Exactly.
it, it'll be okay. As you said, they're looking for outside validation. But with those outside validations, you have to manage your
Yeah,
expectation.
yeah.
Because
I mean,
I can expect you to in that 20 minutes, I go in with a list with my doctor. I say, okay, we got 20. I know we got 20 minutes together. And she loves it because I'll tell her this is this and this and this. But I can't expect for her uh to heal me or help me heal because she's not a healer, she's a facilitator. I can't expect for her to do her job if I don't contribute. So I
yeah,
say this to you, Brains, that you need to be an active participant in your life.
mhm,
We are
totally.
we are the overseers.
Hmm.
Okay. We are living in this energetic universe,
Hmm.
in this meat suit called the body.
Yeah, totally, totally.
And it's interesting when people come up with these new, well, not because I've heard of RTT before, but when you're a medical professional and you go and you tick all the boxes and I see all your accolades up there on the wall, you just figure, well, you know what? I know it all. When you find something new and revolutionary, it's exciting to you as well and you want to share.
Totally. Totally, totally. And as I said, I think with my daily job, what was really missing was fulfillment.
Mm,
Those 20 minutes are fine, but one patient, two patient, three patient, four. It's like, yes, I worked really hard. Did I genuinely connect with somebody? Did I genuinely
right.
transform or shift some inner block? I mean, yes, our physical bodies are very important, but I really believe that any disease, any discomfort that we have, it's not just in the body. There is always a psychosomatic basis to it, right?
Mhm.
So, say for example, somebody has any autoimmune diseases or asthma. I mean, as a doctor, I tell you, if well, I'm not a respiratory specialist. I specialize in eyes. But if you go to any doctor, you say I've got asthma, they're only going to give you tablets. Oh, this is going to control your symptoms, but we cannot cure asthma. So there are a lot of diseases, most of which are autoimmune origin. So there has to be other things. There are emotions, there are blocked emotions, there are other things involved. So
And
yeah,
I'm hearing that over and over and over again. I'm hearing a lot of physicians going into integrated medicine. I hear nurses going into holistic. I hear a
yeah,
lot of nurses now doing hospice care and end of life
there's a
care.
reason. There's a reason because
They're seeing the energy transform. I'll tell you, when my mother passed away, I
Mhm,
was bit, but I was not broken. It was a beautiful transition of life. She gave me permission to stay. I
mhm,
gave her permission to go. Her life journey and purpose at that point had come to a conclusion. It was time to evolve to the next level of awareness,
mhm.
presence, circumstances, well, however you want to phrase it. But I knew that it wasn't the end. And I
No.
actually saw her soul leave
Mhm,
her body. And I tell you, I'm in my office now. I converted
mhm,
my studio
mhm,
was her room. And there's
mhm,
such a sense of peace and harmony and
mhm.
love. And if we could just find that among ourselves before we make that transition. I was talking to another one of my guests because giving birth and being born is stressful.
Oh yeah.
And and dying and transferring life is stressful.
I
So how
think
can
what
you not expect to get that somewhere in the middle?
Yeah, totally. I mean, see, when it comes to body, I love thinking of it like with this example in my head. If you were to buy a car and you were told that you have this car for 80 years, 80 years. Okay.
Mhm.
No upgrades, nothing. How how much care would you take for that car? So
Mm.
just think about it. That's what our bodies are. Now, whatever religious belief or non-religious, spiritual, whatever you believe, doesn't matter. But this is what you've got for, let's say, plus minus 80 years. And people put just, you know what I mean? Like, how much care. Now, I'm not saying, you have to become body obsessed or looks obsessed or anything like that. It's like that's your vehicle. You need to take good care of it. And I do not differentiate between mental health and physical health. It's all one. Health is health.
Mm.
Mental health, physical health, it's
Well, and
all.
I tell people that a lot of people, I'll talk about Black people, they don't
Mhm.
do the therapist. That's not, they'll talk to the pastor, they'll talk to their grandma,
It's
they'll
taken
talk
as
to their
weakness.
girlfriend. Right. They take it
Yeah.
as a sense of weakness. But if you check your heart, your kidney, your liver, your ears, your eyes,
That's fine.
all that's fine. But you need to check your brain too. That's what I was talking about. There are people that I'm thinking about one person in particular,
Uh-huh.
knows that they have a challenge,
All
know
right.
that they're struggling,
Mm-hmm.
but they don't want to get help. And maybe that's a part of the problem. I don't know, but I've reached out and said, what can I do to support, encourage? I'll be there to hold your hand. I love you. And then you get these people that are so downtrodden and in these dark places that they die by suicide. And
Yes.
you feel, or I feel bad because I don't feel like I've done enough. It,
No,
it's
you have. You
it's a
have.
tug of war.
See, think of it like, most of us have learned to create a cage around ourselves. This cage is of Now, this cage can be really tiny or really big, doesn't matter, changes from person to person. So you lend out the hand, but it's like they have to let you in, right? So yeah, it's difficult. It's not always easy. And again, even with RTT, it's a collaborative process. So I cannot say, I'm going to help you. Yes, I'm going to be there for you. I'm going to provide you with the safe space. I'm going to use all the tools. I'm going to help you shatter your limiting beliefs, but you have to be open and collaborative about it. If somebody comes with like, oh, okay, I don't believe in it, but I'm going to try. No, you have to make an active effort to be in it. Otherwise, it doesn't work.
Well, you have to be in it, of it, love it, and want it. And
Mm.
you have done all that and then some. Thank you so much. I want to thank you publicly for being uh, a physician.
Oh,
It is
thank
not,
you.
it is a labor of love. You could have done anything else. You could have been a florist, you could have been a baker, you could have been just a homemaker, but you opt to dedicate your life to the
Hmm.
embetterment of other people. Brains, take advantage of that. Contact
Yes.
her, listen to her. Are you coaching? Are you what are you doing? Is there a program or an offering that you might have? So a way for my brains to get in contact with you if they want more information?
Sure. So how I work is basically you can set a discovery call with me. The discovery call is free, no obligations. It's a half an hour discussion where we can talk about what's RTT, are we a good match for each other, what is your problem? And so basically, we have an open chat about it. If you want to find it, you can just, my website is almost done. It should be publicly accessible in the next couple of weeks. In the meanwhile, if you just type my name into Facebook, in my bio, there's a link tree link. So as soon as you click on the link tree, there's Discovery Call and LinkedIn, and basically you can get to know everything what I do, why I do, what called me to it.
And she is super cool. Okay. Young, hip, pretty, a mom, and I'm
Oh,
gonna take advantage of that. I'm gonna call you on the link tree because
sure.
there's something that I need to know about me that I don't know. And
Yeah,
who better
yeah.
to ask than Dr. Ruchi?
Ah, lovely, lovely.
Brains, go in, like, love, share, and connect. Like, love, share, subscribe, do all the wonderful things that you need to do to make this the best life possible. This is the only one that we know of. So we want to make it as best we can. Thank you so much, Dr. Ruchi. Sorry I mutilated your name. Say your name for my brains one time.
It's Ruchi. Like I said, the designer brand Gucci. So Ruchi.
No, say your whole name for me.
Oh, okay. So it's Ruchi Mishra Sharma.
Ruchi Mishra Sharma.
You got that perfectly right.
And you're perfect. Thank you so much for being here on The Edge.
Lovely. My pleasure. Thank you.
All right.
Thank you.
My brains. Have a good day.